insurance broker with Distinguished Choice. Today I wanted to come to you all and talk to you a little bit about an important topic, and that topic is Medicare Part D. So let's go ahead and get into the basics. So what is Part D? And the way that I remember Part D is D stands for drugs, prescription drugs. So under Medicare, the program must follow federal guidelines. However, it is administered by private companies. So basically, you pay a private company to pick up the cost of your prescription drugs. It's an insurance for prescription drugs. If you use that plan's network of pharmacies, then they will pay a majority of the prescription and you will pay a copay or percentage of the rest of the prescription. So there are some key factors that you always want to look into when choosing a prescription plan or a Part D. And those three factors are network, formulary, and tier level. So I will go ahead and break those down and talk about all three. First, you want to look at the network, making sure that the prescription plan of your choice has a network that includes your pharmacy. All of the plans may have different pharmacies that they are contracted with, and so you want to make sure that the pharmacy that you like to use is included in the network of the plan that you choose. The next important factor is formulary. So you want to look at the plan's formulary. And a formulary is basically a list of prescription drugs that are covered by that specific plan. All of the companies may have a different formulary for all of the drugs that they cover. So it's important to check on your prescription list and make sure that the prescriptions that you take are included in the formulary for the plan that you're looking at. And lastly, you want to look at tier level. And what tier level is basically all of the plans group together specific prescriptions on a tier level based on the cost. And so you'll start at tier 1, which are your less expensive type of drugs, and it will go all the way up to tier 5. And tier 5 are specialty drugs and are more expensive. And so they will categorize them by the cost and the tier level. And so you want to make sure that you look up your specific prescriptions that you're taking and make sure they are on the formulary and look at what tier level they are on so that you will know what your cost will be. An important thing to remember is that all plans must follow federal guidelines. And so the federal government does outline the drug payment stages that must be followed for prescription drugs. All of the plans have these stages. So you start off with your first stage, which is your deductible stage. During this stage, you must pay up to the plan's deductible for your prescription plan. Some plans don't have deductibles, some plans do, so it's important to ask your agent if the plan does have a deductible. The next stage is the initial coverage stage. And during this stage, you will have to pay the plan copay as outlined by that specific plan. So remember the tier levels, you will pay the copay based on the tier level of your prescription. The next stage is the coverage gap or the donut hole. And I could talk for hours about the donut hole. We will have another video posted specifically for the donut hole. But basically, during this time, the federal government is tracking the amount of prescription costs that you have, and during the donut hole, you will have to pay a little bit higher for your prescription drugs. And this applies to all plans. The last stage is the catastrophic stage. And during this time, once you have passed all the rest of the stages, including the donut hole, you will actually pay a lower cost for your prescription drugs. Regardless of the tier, you're going to pay a lower cost. So all of those stages are included in all of the plans because they are laid out by the federal government. There are some other important terms to remember when talking about Part D plans. And these terms are federal guidelines, so they apply to all of the plans, no matter what plan you choose. The first term is step therapy. And step therapy basically means that if your doctor prescribes you a specific medication for your illness, the pharmacy and the plan may ask you to use a generic or lower costing drug for that same prescription. So they will try to save you some money and also save the plan some money by using step therapy. Another term is quantity limits. So basically, the plan will be tracking the prescription based on what your doctor has prescribed. And sometimes if you go early to pick up your prescription, you will not be able to pick it up because they want to make sure you're not overusing the prescription, and they will place quantity limits on them. Another important term is prior authorization. And again, this is for all plans, no matter what plan you choose. If your doctor prescribes you something, even though you have that prescription, the plan will go back and ask again for the doctor to send in another authorization. And this is just to make sure that the prescription is being used safely and effectively. And then the last term is asking for an exception. So sometimes once you've joined a plan, if you are now prescribed something different that is not on the formulary for that plan, you can go to the company and ask them to provide an exception for that specific drug for a limited number of days. And so if you do ask for that exception, the plan usually has only 72 hours to get back to you with an answer of approval or not. And lastly, I wanted to talk to you all about the dreaded late enrollment penalty. Unfortunately, the federal government does impose a penalty for anyone that goes without a Part D plan for more than 60 days once they first start Medicare. The penalty is fairly small, but it does increase and add up every month that you do not have a Part D plan. A lot of people say, well, I don't take prescriptions, I don't need a plan. That could be true, but during that time that you do not have a plan, you are incurring a penalty. There are ways around this penalty, and I could talk about the penalty for days. And we will probably save that for another video. But again, we're available to sit with you and talk about this penalty and more. So that's all I have for you today regarding Part D. I know there's a lot of information and it sounds a little confusing, but remember, we here at Distinguished Choice are willing to sit down with you and meet with you regarding your choices. We can help you hone down on the plan that fits your needs best. Remember, we are available for in-home appointments or also via email or telephone. I will provide my contact information. Thank you all again for listening and have a great day.